Good morning. It's Wellness Wednesday, and I thought for today we talk about what does it mean to have comprehensive weight loss. Because you hear this term, maybe you've heard it before. Maybe calling our office or coming through our office. It's the first time you've ever heard that term, comprehensive weight loss. But I'm going to tell you it's changed for me a little bit and become more defined as I've grown in the past years with doing more weight loss. Some of you may know, some of you may not know. I started off in primary care internal medicine back in 2005, 2006, and then really jumped into what we call obesity medicine or weight loss medicine in 2012. And I've learned to perfect it. And it's a continued journey because medicine is, there's always something new. If we stop learning, shame on us. So I'm continuing to perfect what I feel is comprehensive weight loss. So what you can expect when we come to our office is looking at you all together, not just how many pounds or inches do you need to lose. It's how can we help your lifestyle? How do we help you feel your best self? You might have heard that term as you watch some of our webinars or you've come through our offices. What kind of lifestyle do you want? This is not come in, fit into your dress, and then we're done with it. Even though I do have some people like that, but what I love is they learn to go, oh my gosh, I can keep this weight off. It's not just, getting ready for an event. It's not just getting to a surgery and losing those pounds. My goal is you get that idea of, oh my gosh, yes, it might be a little deprivation right now, but I'm learning how to live my best life. And it might not be just a number, where sometimes we look at our what our expected BMI is, and that's, you're thinking to yourself, I can never get to that weight again. It's more like, oh my gosh, I lost 20 pounds and my knees aren't hurting and I can get up from a chair without assistance. Like, to me, that's a win. Not that you've lost the 50 pounds that the scale told you you're supposed to. It's you lost the 20 pounds and you feel better and you're more active in your life. That is incredible to me. And so what comprehensive weight loss means is looking at you specifically and seeing what your goals are and what your body means and needs. And so it's going to mean what kind of diet. It's not a one size fits all. We might use meal replacements. We might use whole foods. We might do food allergy testing and see what is causing inflammation. It might be causing bloating and achy joints and a runny nose. You might not have known that. It might not just be an icky gut. I mean, food can do lots of things to us. It might be, how's your sleep? We talk about sleep. So many people think, oh, I don't need a lot. It doesn't mean anything to my weight. And it is incredibly necessary for weight loss. How you sleep can help you or hinder you in your weight loss journey. It can be, how much water are you drinking? What fluids are you drinking? So many people don't realize that. And when I get them to narrow down and tell me what they're drinking, that we can cut out so many different calories from sometimes the drinks that we have. It can also mean your mindset, right? So we can talk to our bodies. We can get that mindset on board, turning on that switch that says, I'm ready for weight loss. I'm ready to take care of myself. I'm ready to make the changes that are necessary. It can be just watching your calorie intake. I just got off a phone call with someone, and it's amazing when I do that with my patients when they're thinking they're stuck, and I just encourage them to write down what they're eating for a week. And we might find some hidden calories that we didn't even know about, or portions are a little bit bigger than we even thought they were. And then we're like, oh my gosh, I am over the caloric amount that I'm supposed to be at. And we make those small little changes, and here's another thing that I really love. And it came to really a head yesterday, where one of my patients who I hadn't seen in a couple of visits has been able to see parts of my team and have been working on different things. Her main goal yesterday was not having pain. She has fibromyalgia. So she didn't care that she didn't lose any weight in a week. She just wanted to know how to get rid of some more of her pain, because some of the medications she had been on had caused some of the weight gain, and she wanted to come off of these medications, and she had successfully come off some of them, but then she was stuck with, what do I do about this pain? What are other things that we can do? And I was able to take that appointment, and we put weight loss discussion on hold, because what she needed to talk about was pain control, her fibromyalgia control, because that causes her to emotionally eat, right? That causes her to not think about, what's best for me to put into my body. It's more of, what can I do to get rid of this pain? And I loved that we could transition that appointment and talk about what are some of the things we can do that are not going to cause weight gain, and help her. Because if she successfully if we as a team can reduce that pain, she can then focus on the weight loss portion, and she's going to be successful at it. And so that's what you're getting at our office. So you're getting that comprehensive look, because it's more than just calories in and out. It's so much more than that. And we have teams of psychologists too that I love, because they can do what's called CBT, cognitive behavioral therapy. We can reteach our brain so many things. It's called neuroplasticity. You are not stuck with, that mindset. Well, you can be, but if you are willing to learn and meet with people that can help change that, not only can we do that at Activated Health and Wellness, but I have, incredible referrals of those who are just as passionate as I am to help retrain the brain and help us on that journey. And so we love talking about comprehensive weight loss, and that's what it means. Not just calories in or out, but it's going to look at your sleep. It's going to look at your body's health, what medications you're on. Certain medications can promote weight gain. Sometimes just changing to a different type can help with that weight loss. We're looking at hormones, where you are in life, your stress level, whether it's at home or your job. There are so many things. And so I love being on this journey with you. I love the team that we have put together to help you get to your goals. And you know what? It's not always just a beautiful, smooth sailings. I like when we have roadblocks. I like when there's bumps in the road, because that's what happens in life. And we want to go through those with you so that you are prepared for when they happen. And that's what I'm also going to encourage you. What comprehensive weight loss means is, we want to help you lose your weight and get to your goals, but also to sustain them, because life happens. Vacations happen, holidays, birthdays, anniversaries, job wins, job losses, and they all can affect us, and they affect our health and how we think about food, how we use food. And we want to be on that lifelong journey with you so that you are successful as well. So hopefully you've learned a little bit about that passion of mine of comprehensive weight loss, and that it is a team effort. And I hope to see you soon. Bye.